Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with Dr. Pamela Habib and Dr. David Schacht. Dr. Habib is head of U.S. Medical Affairs at Bayer Radiology, and Dr. Schacht is breast radiologist at Northwestern's Lynne Breast Center at Prentice Women's Hospital. They're joining us this morning to discuss dense breast and how that can increase the risk for breast cancer. Welcome to Health Professional Radio, both Dr. Habib and Dr. Schacht. Thank you.
Thank you for having us.
Neil.
What is breast density and how does that impact breast cancer, the risk?
So breast density is, and the reason why we want to really spread this message is because I think a lot of people are unaware of what that means. I think when you talk to just a group of women, I think a number of them will think that density is something that you can feel in your breast, and that's actually not correct. And so we're trying to get the word out of what this actually means and what women can do about their breast density. And so that breast density actually, it means how much glandular tissue a woman has in her breast. So a breast has fatty tissue and dense tissue. And the only way to know how much dense tissue there is in the breast is on a mammogram. Mm-hmm. And some women have very little dense tissue and a lot of fatty tissue. Some have a lot of dense tissue, but there are multiple factors that can affect this. So it's not necessarily something that a woman can, there are things that a woman can do, but it's not, it's different for every woman. There are genetic factors, there are dietary factors. So it's very common. Almost nearly half of women actually age 40 or over who get mammograms are told that they have dense breasts. But it is a normal thing. It doesn't necessarily mean something is abnormal, but it is important for women to understand what that means and what risks might be associated with that so that they can have an informed conversation with their doctor.
In addition to looking for lumps and things of that nature in the shower or whenever you've got some time or you may suspect something, the only way to detect dense breast is with a mammogram. Is that enough to detect dense breast?
Yeah. So to your question, that's exactly right. So the way you're able to define whether or not you have dense breast is by a radiologist looking at your mammograms. This is something that is only really determinable when a patient has had a mammogram. To your point, if you feel like your breasts are sort of lumpy bumpy, or a doctor maybe who does a physical exam has said that your breasts feel dense on the physical exam, those are potentially important factors that to pay attention to. But as it's defined in the healthcare system, dense breast determination is only made on the basis of the amount of dense fibroglandular tissue versus fatty tissue that can be seen on a mammogram.
Is this condition, dense breast, something that occurs gradually throughout a woman's life, or is this something that a woman is born with? Are there predetermining factors?
There are some predetermining factors. So we know genetics plays a role in it. However, throughout a woman's lifetime, depending on if there are changes in her diet, for example, her weight, if it increases or decreases, if she starts taking hormone therapy versus stopping, a lot of these factors as well can impact it. So some of it you're born with, some of it changes over time as well. And one thing I wanted to add is that some people are unaware of what that means to have dense breasts. And really there are two major things that get impacted because of having dense breasts. One is that it makes it much more difficult to detect cancer on a mammogram. So on a mammogram, breast tumors appear white, and that's actually the same color as the fibroglandular dense tissue. And so the more dense tissue there is in a breast, the more a tumor could get hidden because the rest of the fatty tissue appears dark. And then the other thing is that we know that it does actually increase the risk of breast cancer as well. So it's not just the fact that the tumors are hidden, but there is an underlying increase in risk as well. So women with extremely dense breasts, for example, are 4 to 6 times more likely to develop breast cancer than a woman that does not have dense breasts.
Is there an invasive procedure to determine what is dense breast and what is actual tumor once they're both identified on the mammogram?
So, if there's concern that there may be an abnormality on any mammogram, be that in a patient with dense breasts or not, typically what would happen is that additional tests might be necessary. We can take special mammographic views to try to help differentiate between whether the area could be normal breast tissue versus a tumor of any sort. And then additional tests can also be performed to sort of help make that differentiation. Most commonly, that would be with an ultrasound in the setting that you're talking about, where there is some concern on the part of the radiologist as to whether this could be normal tissue versus an actual tumor of some sort. And all of those things would be done no matter whether the patient had underlying high breast density or not. Those standard workups are helpful for people across the entire spectrum of breast density. And I think it's important to realize mammograms have been shown to save lives across the entire spectrum of breast density. So whether or not you're a patient with high breast density or not, starting point for screening 101 should always be your screening mammogram. On top of that, what we've learned over time is the benefit of potentially layering additional screening tests for those patients with high breast density in order to sort of work out the facts that, one, we're just not seeing potentially everything we might prefer to because of the underlying breast density, and two, studies have shown that there is increased risk of breast cancer in patients with high breast density.
Dr. Habib, what roles do breast size or age play in determining the cancer risk?
Breast size itself doesn't really indicate whether there's dense tissue or not. So it's really a matter of, so the patient's overall body habitus can impact that, but the breast size itself would not help let somebody know if they have dense breasts or not. Age can be a factor over time, depending on, but it's really a combination of all of the factors that I mentioned previously. Mm-hmm. And for a woman, that could stay steady over time, or that could change depending on different factors.
Is there a certain time that patients should start being concerned about the possibility of dense breast?
Right. Usually the time to start thinking about breast density would be after you begin obtaining normal screening mammograms. For the overwhelming majority of people, my recommendation is to start annual screening at the age of 40. However, certain patients, based on family history or other risk factors, may start screening at a different age than that. And in our medical reports that go to, you as a patient, your regular doctor, the density would be recorded as well.
Is the presence of dense breast or that indication a risk factor just without any other factors being present, diet, age, family history, just the presence of dense breast? Is that enough for breast cancer alarm? We
know that it increases risk. And so I want to use the word alarm, but it should flag that there is an underlying increased risk. It's also harder to read the mammogram now that there's a lot of dense tissue. So we should just be a little bit more hypervigilant, have that conversation with the doctor, see what your options are, let the doctor assess your other risk factors and make that determination of what's best for you.
Give us a website where we can learn more.
Absolutely. So we have a website, understandyourdensity.com, and anyone can go to that website and answer a couple questions and learn more about dense breast.
Well, I appreciate both of you joining us here on the program this morning. Been quite informative and a pleasure speaking with you both. Thank you.
Thank you so much.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Pamela Habib and Dr. David Schacht. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.